Hello, and thank you so much for tuning into my podcast. My name is Kara, and I'm a holistic health practitioner for both people and pets. After working for years in the conventional medicine field, I realized that while our lifespans may be getting longer, our health spans are rapidly shrinking. And when it comes to our pets, both their length and quality of life are decreasing. When I turned to functional medicine and a more holistic approach to health, I saw dramatic improvements for my pets, myself, and my patients. Join me each week as I merge natural health for people and pets by focusing on the root cause of disease and applying raw, real remedies that you can use to improve overall wellness for every member of your family, including the furry ones. Hey everybody, welcome back to this week's episode of Raw Remedies. This week I have Dr. Lynda Loudon as my guest, and she is one of my favorite holistic vets in the holistic pet space. She has a calm powerhouse presence and over 23 years of experience in emergency integrative care. She's the go-to guide for dog guardians who want truth over trends and longevity over quick fixes. Whether she's gently helping families say goodbye through peaceful transitions or lighting a fire under future canine pros in the Canine Experts Academy, Dr. Loudon keeps it real, kind, and ridiculously useful. With a perfect balance of modern wellness and ancient wisdom, she's a canine longevity expert, grief doula, entrepreneur coach, and truth teller all rolled into one, having dedicated her life to building legacies for dogs and their people. This week we talk about the hard topics, from end-of-life transitions to emergency vet visits and more. This is information that every pet parent needs to know, so I hope you find our conversation as inspiring and educational as I did. All right, we are back with Dr. Lynda Loudon to talk about some kind of heavier topics today, but ones that I do feel are really important to discuss. So let's jump right in. And first, can you just give our listeners a little bit about your journey into vet medicine? I really want to know what made you focus on emergency care, which really speaks to me because you know that that's been the majority of my healthcare years, is working in the conventional emergency space. So I would love to hear more about that from you.
Yeah, definitely. Thank you so much for having me. I'm happy to be here. I originally wanted to be a surgeon. And when I went to vet school, I thought I would be a surgeon because I love surgery and it's still one of my favorite things to do. But I had kind of gotten into emergency. I had gotten into emergency as a technician before I went to vet school. And I loved it. I loved the fast pace. I loved, treat them and street them, like keep moving on, fix it and move on, fix it and move on, hopefully, right? I think that really fed my personality. I really thrived in that. I didn't like dragging things out like with chronic cases at that time. So I loved the fast pace of the ER as a tech. And then as a doctor, I really wanted to, I was going down the surgery route, but I kept getting pulled into the ER by the criticalist in vet school because she knew I had been an ER tech. And she's like, go get Loudon. We need Loudon again, or putting in central lines and stuff. And she's like, you need to do this. And I was like, no, I'm going to be a surgeon. And I kept trying to push going down that road. But every time I would get called back in there, it felt like home to me. It just felt comfortable. It flowed. And then I realized, I think I wanted to be a surgeon because I wanted to make a really big difference. And I do like, that's another surgeon mentality, right? You just fix it and move on. And that worked for my personality. But I just realized I'm going to help the most critical as an ER doctor. They do need me the most. And I loved that, being that person who was there when they needed me most. And so at that last year in vet school, it was a blessing. And I'm sure, not an accident that criticalist kept pulling me into the ER, because then I was like, okay, this is home and this is where I should be. And I loved it. I've loved every minute of it.
I love that so much. I completely get it because I started out as an ER nurse and found my way down to the emergency department kind of on a whim. I thought, maybe I would like this. Fell in love with it. I never wanted to leave. And so when I made the decision to go back to NP school, I actually really second-guessed myself for a while because I was like, I love the ER so much. Like, do I actually want to do this? And I went, and then I went back to the ER as an NP, and I worked there for, oh my gosh, I think 5 years before I moved to California. So And I did love it. Things changed a little bit in 2020, and interestingly, it never went back to the way it was. So emergency care is a little bit different in a lot of places compared to what it was before 2020. So I don't know that really even that like the thing that I loved is not quite what it was. So I don't even know if I would feel the same way if I went back. But I understand that call. It's just like you kind of feel it in your soul, you know?
Yeah. Yeah. And you either love it or hate it, I think, for most people.
Exactly. You love it or
My
you hate it.
husband is a vet.
But
He's like, no, thank you.
my husband is that way too. He can't even like if I cut my finger the other day. You probably can't see it. But just an FYI to everybody listening, if you drop your knife, let it fall to the ground. Don't try and catch it in midair. It's a terrible choice. But I cut my finger and he's like, "What do you want? I could get you a napkin and some duct tape." And I was like, "Is this what we do here in this house?" Because when he cut his finger, I took him into the bathroom, I got him all cleaned up, and then I had to stitch him up. So oh God. So yeah, I think some people are meant for emergency care and some people are not.
It's
But
just not. Yeah.
that is a very big, it feels, jump to end of life care, kind of like hospice and euthanasia care. And you also do that. So how did you make your way there?
It's always been a part of my career. And,
Hmm.
I'm a very intuitive healer, and I feel very connected, especially to dogs. And so when I would have to perform a euthanasia, I didn't shy away from it. I wasn't one of those vets that was like, oh, I hate it. I can't be in there. I don't want to do this, which I get, right? I wanted to be in there. I wanted to support the guardians because I understood it. And I love people just as much as I love animals. So I love the part of being there for them, but I also could connect to the animals, especially dogs. And I felt like that was a gift for me that I had to utilize and be there for them, and giving, if I couldn't save them, which saving their lives was just, that was my rush. Like they come in where they were just critical and I could save them. That was my day was made, right? But if I couldn't save them, I wanted to make sure they had the most peaceful passing. And a friend had asked me, so it was already really important to me, but a friend had asked me to go to her friend's house to euthanize, I think it was a Wheaten Terrier. And he was very aggressive in the clinic. He was a fearful dog, and he had fear aggression. And she's like, it will be a nightmare if this dog has to go into the clinic. And I was like, yeah, sure. I'll go to their house. No problem. And it was the most beautiful experience because this dog was laying in his bed. I walked up to him. I asked everyone just to let me handle him alone. I didn't want to wrestle him or hold him down. I sat with him. Our energies met. Aw, someone's joining us. And then I was able to put an IV in with no one else to this fearful,
Yeah.
aggressive dog. He showed no aggression. He was in his home, in his bed, no fear. And he was able to just pass surrounded by love of his family where he felt most comfortable. And I was like, well, I have to keep doing this. Even though I'm
Yeah.
an ER doctor, I always did that on the side, as much as I could.
Yeah. That really speaks to me as well because I've seen a lot of death in human healthcare. And I think one of the most tragic things is when people aren't ready to let go, even though you can tell as a provider that it's time. And I think that can really kind of lead to a lot of like drawing out of extra care and proceduralizing, and those kinds of things can cause suffering. But it's hard for family members to see that when all they see is my family member is alive or my family member is going to die, right? And so I think that having that, being able to really connect to the animals, especially dogs, the way that you do, I feel like that must be really helpful in this business because I know that you've shared stories with me about how you've gone for a case before and you got there and realized this dog is actually not ready to go, and maybe vice versa. So can you speak a little bit about some cases like
Yeah.
that?
Yeah. I try to connect to my patients before I get there. I can't always, but most of the time I can. I can feel them to a point where when I get there, they know I'm coming. A lot of times. I have dogs that will meet me at the door that haven't walked in weeks. And the owner, it gets a little confusing for the owner because the owner's like, oh, he's better. And I'm like, no, he's just really ready. And
Yeah.
he's excited that I'm here. And but I have had dogs. I had this orange cat that I remember really well, met me at the door and was like, oh no, keep going, girl. Like, I'm not ready. And I don't, I don't want you here. And, and I could tell even just physically, I didn't need to feel that from the cat. I could tell he wasn't ready. It was an owner who wasn't ready to care for what he needed. And so that creates another issue, right? Because I'm also responsible to make sure this pet gets what they need. And if I don't euthanize them that day, will they get that? And I have to make sure of that too. And that's the hardest part of my job, for sure. Is when I feel like, this dog's could go a little bit longer, but the owner is not prepared for whatever reason. And I don't have judgment for that, because sometimes, we all have our own journeys, and they're not there in that journey to be able to cope with whatever's going on with that pet. And sometimes I have had to make a decision like, this pet's going to suffer if I don't today, right?
Yeah.
They might have had a couple more days or weeks or whatever, but if I don't do it today, they're not going to get what they need. But in that case of that cat, I had to leave. I was like, no, he's really not ready. He's got time.
Yeah.
Go get hyperthyroid meds. And if you can't, here's my number. I'll come back and get him, So, but for most of it, I feel, and this is my perspective and what I feel from the animals, is it's rare for them not to be okay with it.
Mm-hmm.
They don't think, from my perspective, like we do. They're not like, as owners, we beat ourselves up like, oh, if I should have tried one more thing, if I tried a different vet, should I have done the surgery? I feel that crazy from the owners when I walk in the room. I feel all of it. Never from the dog. The dog's not like, damn, couldn't you have tried one more thing? No. They're like, this is how it goes, and I'm ready. Let's go. The only time a dog will hold on, especially a dog. Cats, I haven't felt it as much, but a dog will hold on for an owner who's suffering. I've had a dog who wouldn't let go, and I knew it the minute I walked in the room this was going to happen. An owner who had just went through a really tough divorce and was really going through it. A lot of things, had just lost another dog the week before, and I knew this dog wasn't going to let go because he felt he needed to stay with this guardian. And I've given dogs in these situations, I've told the guardian he's going to have a tough time with the sedation. And I use heavy sedation when I first go in. Very heavy stuff, not stuff I would use in the clinic, right? Mm-hmm. But these dogs, it doesn't medically make sense, but they won't relax with it. And I warn owners before I even give the injection. I know this dog is going to hold on to you. I'm going to leave, and you have to convince them you're going to be okay. Yeah. And let them go. And then I'll come back in, and they'll just fall asleep. But that's the only time I feel dogs will really hold on, is for the owner, not for themselves. They're okay with it.
Yeah. Animals have they're, I think, the master empaths, and they have just such unconditional love, and their only goal in life is to see us be happy and be our truest and fullest selves so that they can be that with us. Cats, I don't know, Goose, what do you think? Do you care about my well-being, or? He was looking at me with slight disdain, so I'm not sure what the answer is. But no, I'm only kidding. Our kitty's
out. Like, you just need to figure this out. Or the dog is like,
he's like,
this is how you should be.
Oh no, our kitties love us too. But
they do.
Yeah, I think that deep well of empathy that they have makes it I think, easier for them to know when it's time and to be able to let go of those things. They don't hold on to the worldly stuff like we do. They don't hold on to the guilt like we do. And I think that must be, to be able to understand that as a person who has to perform euthanasia, I think that that must be very freeing for you to know that, right? Because otherwise I think it would be, that's what turned me away from vet school, actually, is I was in my college doing prereqs, ready to go to Cornell, and my childhood cat suddenly had to be euthanized. And I sat there holding her, and I was like, oh my God, I can't do this as a career path. And I went to school the next day and changed my career path to somehow to nursing. I mean, that's not really that different, but watching people be ill as opposed to animals.
Not the animals.
Exactly, right. But yeah, so I was like, I can't do this. And I think if I would have had the understanding back then, that emotional intelligence to know that when it's getting close to the end of life, they're not leaving with regrets. They're just moving on to the next. I think that maybe my career path would have been different. I don't know.
Yeah, and it is freeing for me. I get the question, which is my most hated question, is, I don't know how you do this, or how do you do this? And I know that people don't mean it in the way I tend to take it, but it makes you feel like you're cold, right? Like, I don't know how you do this. And sometimes it's the way they say it. I'm like, oh, I hate that. But for me, the emotional part is more for the guardian most of the time.
Yeah.
Because of what they're going through. And I feel it. And I've been there and I know it. The dogs, I'm talking to them on my way home. I feel them. I feel them move on, and it's different for me than it is with the person. And of course, there's this situations where it's a dog that is dying young. It's a sad case. It's not a nice old dog in their bed that's lived a full life. Of course, those get to you all the time. But in general, for me, the majority of mine are those older dogs. They've been through it. They're ready. And that, makes it not as hard. And I don't, people think that I do this or euthanasia vets in general. And some do it as a side gig, like, oh, it's another thing that I could do. But for me, it is a calling. And I love it. And it sounds weird for people to hear me say that I love this work, but I do. Being in that room filled with love is such an honor and a privilege to witness this room just pouring their love into this pet and sharing stories with me. I had a cat yesterday. They were telling me he used to open the fridge and eat their lettuce, right? Now I'll never forget that. And now all day picturing him going into the fridge and chewing on lettuce. And it's like I get beautiful stories and that I get to take with me. And it really is a privilege to be able to be there and do this.
And I can attest to that beauty too, because as much as I've seen tragedy in the human healthcare realm, people coming in emergently, people coming in actively being resuscitated, and of course there are many times that we can't save them, and it's tragic. But when you do get the chance to really properly set up end-of-life care for someone, no matter their age, and see the family come and gather and see them all be there and tell stories, and there's sadness, but there's just so much love. And I have seen the same thing when someone is just waiting for their family member to say, it's okay, I'm going to be okay, you can go. And then like that, they're gone. And I'm not a religious person per se, but I do think that there is some spirituality there where even if people are, and animals too, not quite awake, right? Not quite, they can't interact. Maybe they're not cognizant. They won't speak to you. They won't bark at you, but they just somehow know intrinsically that you're there, and those emotions just resonate. And to be able to hear, all right, I can go now, they're going to be okay, I think it's almost like the magic words. And it just really can be a very beautiful thing during a painful time.
Yeah, and you see so many or hear so many stories of that where
Hmm.
someone just finally, whether it's human or animal, they just got home from vacation and then they waited. For me, my dad, I've had a lot of loss in my house. Sorry, Zane
It's
is
okay. Is that Zane?
barking, so I'm trying to, Zane, come participate instead of barking at the strangers like you're supposed to. Um, I'm trying to distract him with love. Um, but my parents died when I was in my early 20s, and my when my dad passed away, I wouldn't leave his side for days. It was like 5 days in the hospital. I wouldn't leave. I wouldn't eat. And the minute I left, they forced me to leave. The minute I left the room, he passed away. He just didn't want to do it in front of me.
Yeah.
And so it's amazing. It's all amazing experiences and beautiful, sad, but part of life, right? It's all
Right.
part of it.
So, kind of swinging the pendulum to the opposite side, then, is the emergency care, right? So now we're coming in almost the most frantic that you can be. And I sadly have been on the pet parent end of needing to take an animal to an emergency vet. Um, it ended for me in tragedy. It was because of a car accident.
Oh,
But I think that there are a lot of things that can bring pet parents to an emergency vet. And I think that not all of them always need to be emergency visits. So I'm curious your take and perspective. Like, what would you say you see the most in terms of maybe true emergencies, but then also the things that could have perhaps been handled at home if we were a little bit more prepared?
yeah. Yeah, I would say the true emergencies for you to know if you need to go there quickly would be a possible toxin ingestion. Have that phone number on your fridge or in your phone or both for poison control and, make that call right away. Maybe it's on the way to the ER. So toxins you don't want to play with. Um, Anytime your dog gets suddenly weak, their gums turn pale, their color changes, that's serious. That's shock. That's something's coming. That's not good. Um, if they're having vomiting and diarrhea, it's probably the most common reason people come into the ER. And some will come a
Yeah.
little bit early, where, okay, it's some diarrhea. You could have added a little psyllium husk, a little fiber, a little ground, gently cooked turkey and sweet potato for a few days, or pumpkin, and your dog would have been fine. You probably didn't need
Yeah.
the ER. On the other end of that, when there's intractable vomiting, they're vomiting more than 3 times in a window of 6 hours. They're losing all that fluid from both ends. They're starting to have other symptoms like they're really lethargic, they're weak, they have no interest in food. You're probably not feeding them at that point anyway, but just other things show up. Their breathing pattern changes. Those next symptoms that are coming from the secondary effects of that vomiting and diarrhea, you don't want to play with that. You want to get into the ER and get some fluids and find out what's going on. And bee stings, we see so many of those. And they can be severe, but they don't tend to be like with a human where your throat could close and
Yeah.
you only have a very small window to get an EpiPen, right?
Yeah.
For dogs, it's more, okay, I look like a Shar all of a sudden. My face is swollen,
Yeah.
which is really freaking cute.
Yeah.
Um, I have hives. They get those bumps all along where
Yeah.
sometimes you just see the raised hair for their hives, and they get really crazy itchy. And there are some things you could do at home. If you do have the Benadryl at home, you can do that. Um, um, there's other things that you can do and try it, see if they just relax and things start to come down. If they keep coming or they just get a little better but get worse, or secondary symptoms like vomiting happens from an allergic reaction, those are things, then okay, you have to go in.
Okay. That makes a lot of sense to me because, actually, I think we're very lucky in this house. Somehow, none of my dogs have ever received a bee sting. I'm terrified of bees
Oh,
and all things that buzz and are yellow, but as many times as they've tried to eat bees, we've never been stung by one. But the vomiting, I agree. And I think I get a lot of people who, when I work with clients, will reach out to me, especially when you're starting to transition an animal onto fresh food, or if they have chronic GI issues. It takes just one thing to set them off, and then they're having a flare. And the vomiting stinks. Diarrhea is the worst. But yeah, those electrolyte disturbances that you can possibly get from having profound dehydration can be really, really dangerous. And that's when I tell people, if they're not drinking, you can't get fluid into them, emergency, because you can't. I mean, if you get your potassium gets messed up, your magnesium gets messed up, you can get arrhythmias, cardiac arrest. It's really scary. What about, so you mentioned like diarrhea, a lot of times that can be handled at home. What about when we see bloody diarrhea? So bloody diarrhea in animals is a little bit different than bloody diarrhea in people.
yeah. That's severe, right? That is telling you that there is severe inflammation of that gastrointestinal wall, that it's bleeding. And when you start to see blood, like a lot of blood in that diarrhea. Now, I'm not talking just, okay, they had a formed stool and there's a little blood. That could be an anal gland issue. It could be a little bit of colonic inflammation. It could be something else on the way out. But when you have diarrhea coming out that's blood or melena, that is bad. And when that starts to happen, the fluid shifts in their body. They're going to get dehydrated so much more quickly than regular diarrhea. And it's much harder to get ahead of that again. And so you don't want to let that go, especially in little dogs who are more prone to hemorrhagic gastroenteritis. So you don't want to wait on that. Get them in, get them on fluids. And a lot of times when it is severe hemorrhagic diarrhea, they do need IV fluids in order to get that hydration back to where it needs to be.
Yeah, I could see that for sure. And the melena, so that's for people who don't know what that is like a black kind of tarry looking stool. That's digested blood, which is normally coming from up higher in the GI tract. It's not super common for dogs to be having melena, like gastric ulcers and things like that can cause it, gastric cancers, the scary stuff. But then, of course, it can be easy to mix that up with, oh, I just gave my dog a giant hunk of liver yesterday for this first time, and maybe that gave them a dark tarry stool. So I think it's important to know, like, what are you feeding? Was something new? Especially when we're talking about like GI upset and stool changes, is always take just 1 second to reflect back and go, what did I feed them today and yesterday that could have caused this? Because I'll tell you, I've had humans come into my ER with maroon stools, and I asked them what they ate the day before. And the amount of times I've had people tell me that they had like prunes, and I just have to say, you're fine, So I think important to just know what you're feeding if you're seeing GI changes, for sure.
Yeah, and while we're talking about the dark tarry stools, it made me think of charcoal. And that's a good one to have on your shelf if your dog gets into a toxin, for most of the toxins, charcoal is a binder. It's going to bind to that toxin. So hopefully they stop absorbing it while you get them to the ER. So that's a good one, especially if you're on vacation or you're camping and you're out somewhere. Make sure you have some charcoal with you in case your dog gets into something.
Yeah, and I think that's why poison control can be really helpful for that too, right? Because they can tell you, yes, this is something you might give charcoal for, or, oh, this is actually benign enough that you could potentially induce vomiting, right? Because we don't want to induce vomiting for every potential toxic ingestion, because it could be just as harmful on its way back up, correct?
Right. Yeah. Yeah. There's things, especially like some foreign bodies, anything you think that's going to cause problems to the esophagus on the way back up. Anything that you really worry about them um, inhaling, if they vomited it back up, you have to be careful with. So yeah, poison control is awesome. And I do get some pushback with owners where they're like, you're the doctor. Why do I have to pay $60 for poison control on my way to you? And I see their point, but the thing is that these toxicologists, that's all they're doing.
Yep.
So they have all the data. They have any new cases that have maybe changed a protocol. They're keeping up with all of that. And it's a quick phone call that's worth doing. And if that
Hmm.
toxicologist can give your vet any new insight, then it's worth it.
Yeah. It's the same thing for people. When somebody comes in with an ingestion, be it even an overdose of their medication, prescription medications,
Yeah.
we call poison control. That would be like going to see a podiatrist for your brain surgery, right? Like we know some things, sure, in the ER, but not that is not the same as a person who lives, breathes, eats, and sleeps toxicology. So, yes,
Yeah. And
you
it's
can't understate
also
the importance.
to have all that documented in a record that poison control, the toxicologist was involved with the case. So
Yeah.
that's good for everybody for that to be there. And if something changes, if that case doesn't go the way it's supposed to, we can call the toxicologist and say, have you seen a case like this? Have you seen this happen? And they can look up the case. It's already in there and help, give insight into that. So it's totally
Yeah.
worth it.
So you mentioned the activated charcoal. What are other things that might be good to have on hand as a sort of an emergency toolkit for pet parents?
Yeah. I like having Yunnan Bayu at home. That is a Chinese herb that is great for bleeding. It's great for hemangiosarcoma patients. I, I don't, I think every hemangiosarcoma patient, which is a tumor that originates from the vessels and it bleeds. And often that's the first time we're going to see it, right? The symptoms of it is from the bleed. Unless they're in really bad shape, every hemangiosarcoma patient should at least be tried on that to see if we can get it under control and give them some quality of life. It can also be used topically. You could use that on a broken nail. You can open the capsule and use it on a cut, on a wound. So that's a nice one to have in your toolkit. Any fiber, psyllium husk, organic psyllium husk, canned pumpkin, just have those on your shelf in case you have loose stools, upset stomach. Those are good for that. Um, Let me see. Uh, Quercetin, I like using that for any of the allergic type symptoms. Um, there was one other one that I was just thinking of, and it just left my little brain.
I like slippery elm too, and I know some people don't love it because I think I've heard people talk about like the tree being almost over farmed at this point. I will say slippery elm has helped us a lot in this house because I have a dog who is a little bit prone to GI upset because of his history of chronic pancreatitis. I think it left him with a tad bit of pancreatic burnout, not to the point of needing enzymes, but sometimes he's just a little bit more sensitive than others. And if I see some GI upset, slippery elm turns him around, and it's very, very lovely.
I do. I actually just used it yesterday on Zane. He's been having a little reflux, and I'm not sure
Oh,
why yet.
zany boy.
Um, yeah, and I gave him Slipperyum
Yeah.
twice yesterday and once today, and I haven't seen his reflux, so
That's
it's
so
a good one.
funny. I gave Copper some yesterday for the same reason. He was
Oh,
walking
did
around the
you
house
really?
licking. He's just licking the air, licking the ground. I was like, oh, somebody has GERD. So I
Oh,
gave him some
really?
slippery elm and I gave him a big dose of calm, my full spectrum hemp extract calm. And he was fine within 20 minutes and went right to bed. And we woke up today with no problems.
That's great, and that's
Yeah.
calm is another good one to have.
Yeah.
Any of the CBD is really good to have at home because if if you have a seizure patient or you have a dog that you're going to have to that has any emotional issues and you're going to have to get them to the ER, just giving them something like that on the way is great,
Yeah.
just to calm everything down. uh, so
I've
I
heard of
like
animals
that.
being so anxious and so stressed that they hurt themselves more going to the place that's going to help them. I mean, it's and that can be just heartbreaking. So, yeah, I think that's a good one
Yeah.
to have too. I agree. Totally agree.
And then things for wounds, like I really like dilute betadine for wounds. And I like, hydrogen peroxide is kind of what everyone will say. And what do you think about that? And it's fine if you have a deep wound, like a bite wound that you need to get down there. But dilute it at least 50-50. It's harsh on cells. It's not great for healing. So I tend to grab for betadine instead. And then Manuka honey is great to have for wounds. They're great. I love
Yes.
Manuka for hot spots in the summer if you have any issues with that.
Yeah. Yeah, that's a good one to have. And I use all these things for myself too, right? Everybody who's listening, this doesn't have to just be for animals. I use Manuka honey on my skin. I use it when I'm getting a respiratory virus. The calm, I use a full spectrum hemp track. Let's try again. I use a full spectrum hemp extract for myself for my neck pain that I've had for years and years from nursing and many years of playing the piano. All of these things. If I have, I've given myself gastritis before working night shift. Unfortunately, the swings and the circadian rhythm don't really agree with my stomach, and so sometimes 3-4 a.m. will come, and I'll start getting GERD for no good reason. I'll take some slippery elm, and I'll feel better in about 20 minutes. So these are all things that are just natural herbs and natural modalities that can be used for anyone, dog, cat, person, if that's what you
Yeah.
want to reach for, which I try and reach for most of the time. I'm not saying there's never a role for pharmaceuticals, especially when it comes to an emergency situation, but most of the time, if you have something on hand that's herbal and more natural, it'll work for you. So,
Yeah. Yeah. And, you don't have to worry as much with these natural remedies to the side effects. Are they going to interact with other meds that your dog may be on? It's less likely to cause issues. And so you don't have to be as worried about using them in most cases.
so what kind of things come to mind when we think about maybe even trying to prevent having to come to the emergency vet in the first place? Like, what is there anything overarching that you feel is a good way to just keep our animals in good condition and prevent even, of course, an emergency is an emergency, right? Any animal can ingest a toxic substance. Any animal can unfortunately get hit by a car. But those other things that are maybe not always quite true emergencies, or the things that were the slow build until all of a sudden they became emergencies, how can we try and keep our animals out of there? Not that we don't want them to come and see you, but
Yeah. Yeah. No, I don't want them to come see me. Um, but there's some really simple things that you can do that you wouldn't think of that could end up getting your dog in the emergency. One that I'm really passionate about is collars. My husband, who's a vet, and I have seen so many lives lost from collars. It's
oh
really,
no.
really sad. Little puppies left alone with collars and getting caught on something. I won't go into details, but horrific. Um, my own puppy, Parker, our golden, he was 9 weeks old, and I put him in his crate in the back of the car, leaving with my two young boys from their baseball game. And if it wasn't me being an ER doctor and knowing that little sound was choking, like
Yeah.
that was an alarm for me, we would have gotten home and he would have been hanging. He got his collar caught on the latch on the crate and alligator rolled. And it was
Oh my God.
horrendous. Me trying to get him out. That was one, him having a second door to that crate saved his life because I couldn't open the front because he was stuck on it. Um, and and just things like that happen all the time. We see it in the ER
Yeah.
all the time. So take your collars off when you're not with them. When they're in the house, just take the collars off. If you're worried about not having tags on them, then put a harness on them with a tag that's just comfortable. But I see tags getting caught. They get caught in radiators, on the ground. They've gotten caught on slats in porches, on decks, where dogs have freaked out because their tags were caught. Dogs playing and one grabbing the other collar, and that getting stuck and
Yeah.
accidentally choking the other dog. So simple things like that, just to be mindful and think, I'm leaving the house. Is there anything that could hurt my dog? Is he in a safe place? Do they need a crate to keep them safe until they reach, a certain maturity or training? So things
Yeah.
like that. And then, making those smart choices, just like we make for hopefully ourselves and our kids around food. You know, all of us are told, I was told in vet school that, our dogs had to be on kibble in order to have a balanced diet and live a full life. And we know that's not true anymore, right? And we know that
Yeah.
doesn't make sense. So if you can give your dog um, a whole food diet, whether that's gently cooked, raw, whatever works for you, whether it's commercially bought or you prepare it and you have someone helping you, those dogs, I know those dogs when they walk through my clinic door. I
Okay.
know a dog that is not on kibble. It is obvious. The sclera, the whites of the eyes are bright. They're glistening. They have a shape to them. Their coat has a sheen. It's a different dog. It's a different level of health. And if you want to try to avoid things that normally this healthy dog will probably handle on its own. His immune system is going to take care of it. Whereas
Hmm.
this dog who's living in dehydration because of ultra processed foods, who's living in inflammation because he's over vaccinated and he's getting pesticides put in and on him every month, this dog is going to be in the ER more often than your healthy dog where you're making those smart choices for them.
Yeah, I completely agree. I think just setting them up for success is going to go a long way. And my own cat is a prime example of that. So, oh, Goose heard me talking about cats and he got up. He's shaking the computer. So, my cat, who had to be euthanized when I was in college, she only made it to age 10. And she was fed kibble, never had wet food, had chronic UTIs. We didn't know why. And one day, out of nowhere, she just was lying there and wouldn't get up. We're like, oh no. So we brought her to the vet and she was in florid kidney failure and there was nothing that we could do. And
Sad.
I know now that had she been fed a species appropriate diet, even if it was just a diet of canned food, which still is very processed and comes with its own risk, particularly to thyroid, but had she had some additional moisture in her food, she probably would have lived much longer. And Goose, who was, if you guys were watching instead of just listening, he was the one who was just on camera with us. He's going to be 16 years old, and he's the same species of cat, and he has perfect labs. And he's been on a raw food diet now for several years. But before that, even before I knew better in terms of what the difference is between processed food and fresh food for animals, he still got fed canned food because I knew the importance of moisture because of what happened to my previous cat. So it didn't take me all the way there, but it did give me like that little inkling in the back of my mind, like, what can I do better for my next cat? How can I learn from this tragic experience?
We've all
Yeah.
done that. I can look at every dog that I've had, and I've had a lot of dogs in my life, and I could have done something better for each of them, right?
Yeah.
But we learn and we take it and we grow. We're not
Yeah.
going to get where we need to go without the pain, without the loss, in order for us to
Yeah.
open our eyes to it and see the importance of it in order to make that change. So, and I see that a lot with my euthanasia guardians where they beat themselves up. And we've got to, allow ourselves to grieve and be sad, but take away that guilt or that shame that we could have done better for them. It's not our responsibility to get our pets to live as long as possible. And I know that everybody feels that when they get a pet, like and I love that they feel this deep sense of responsibility. You should, but it's not your responsibility to make every right decision and make sure this dog lives as long as physically possible. It's not our job. We have to let go of some of that and do the best that we
Yeah.
can, learn from the ones from the past, and then let go. We all have our journeys.
If a career in medicine has taught me anything at all, it's that quality will always, always be more important than quantity. I would take one amazing, phenomenal year over 5 years of chronic suffering, because I know that that quality of life was there and they lived it to the fullest. So that is what will always be the most important to me, having seen it firsthand. And I think that's something that we need to be able to instill and say, did you give them their best life for as long as they lived it? Yes? Then you did an amazing job. And that's all you can do.
Yeah. And I train entrepreneurs how to start their online businesses around holistic canine health. And most of them that I teach in my courses have all had a tragedy, a dog they lost too early, where they felt if they had known, they could have made a different choice and a different outcome. But I truly believe that is how it was meant to go.
Mm-hmm.
They come in for whatever time it is, they get us on our path, and then they go. And then the next dog comes in and gets us on that next path. And if that didn't happen in all of these lives, they wouldn't be in my courses, they wouldn't be changing their careers, and they wouldn't be finding such purpose in their life if it wasn't for that dog or that cat that they lost and really felt and wanted either to do better themselves and to help others do better and change the way we're caring for pets. So I think it's actually a beautiful thing.
Yeah. Yep. It brings us, it's the catalyst that brings us here to be able to hopefully help other people. So speaking of your society, can you tell people how they can find you and what you have upcoming?
Yeah. I've got my Dog Mom Society, which is my membership, where I nurture dog moms. They nurture me, actually. But we provide health advice, holistic health advice, integrative advice for their dogs. We help them learn how to be, better guardians. And we also do now women's health in the Dog Mom Society, because we want dog moms to take as good a care of themselves as they do their dogs. So it's a really great community. And then I also have my Canine Experts Academy. And that's where you and I met, where I teach online business, which I never thought I'd be teaching business. But when I left the ER and needed to reach more people to let them know what was going on and why dogs' lives and cats' lives were getting shorter, and I knew I needed to get online. And so once I figured it out, how to start these businesses, I wanted to help other holistic experts. And so you can go to Dr. Loudon Canine, K and the number 9.com, and you can find my courses and my membership there.
Awesome. I love it. Yeah, I really enjoy being in the Dog Mom Society. I like being able to chat with other like-minded people and just knowing that everybody is kind of there supporting each other. So it's a really great place to be.
And you're one of the nutrition experts in the Dog Mom Society.
I do. Yes, I'm very excited. I love talking about nutrition. And I just want to make sure I'm not wrong saying this, but you are going to be doing one of the workshops at the Feed Reel event this year, correct?
Yeah, we're going to be talking about creating your emergency kit for at home. We're going to make some emergency kits there that you can take with you. It's going to be really fun. All, the holistic remedies that you should have, why you should use them, and going into all of that so that you're prepared for any emergency at home.
That's awesome. I'm so excited. I can't wait. That is definitely the one that I'm going to be signing up for. So this is going to be, I think, a great time and just always great education at these events. So anybody who's looking for an October event should check that out. But this was amazing. And I am so appreciative that you took time out of your busy schedule. I see you in your scrubs. I know that you've already been running all day. So thank you so much for taking the time to chat with us, Dr. Loudon. This was so fantastic.
Thank you so much, Kara. It's always a pleasure to hang out with you. Thank you.
Talk to you soon.
Bye.
Thank you for listening. Please remember that yes, you are the driving force that helps keep small businesses and platforms like mine running. So if you liked what you heard, please like, share, and most importantly, rate this podcast. It's the only way we can reach more people and spread the word about natural health. None of the conditions discussed or recommendations given are meant to replace the advice of your health provider. So if you have concerns about yourself or your pets, please confer with a human or animal health practitioner. Have a super fantastic day, and I'll see you next week.